I would like to go over a few things you'll want to know before you get started. When you arrive, you will see a form to fill out. Have a seat and a therapist will be with you. Once you're taken back, a therapist will go over your sheet and ask a series of questions and go over what will take place. I'd like to explain a little bit about the colon and some things you may experience. I want you to understand what the colonic is. There's two parts to the colon, the small intestines and the large intestines. The small intestines is approximately 23 feet long. It starts at the stomach and rounds about in here, and this is where most of your absorption happens. I mention this because the colonic will only clean the large intestines. Even if the water gets all the way over here in one session, it's not going to go into the small intestines. This is a one-way valve. This is why we encourage you to eat well, to keep moving the material into the large intestines. The large intestines is approximately 5 feet long. This is why we suggest doing 2 in a row, because you may or may not get the water all the way over here in one session. Everyone is different. Day 1, you may or may not release anything, but day 2, your colon will take in that new water and then allow it to release. We follow the suggestion and the protocol of the Colon Hydrotherapy School. This is not just a clean colonic recommendation. We follow it because we have seen results with our clients. It takes 30 days to clean out the entire colon. That's if you ate nothing. That is why we recommend 2 days in a row. And then for a full cleanse, 2 a week for a total of 10 to 12 sessions. Now we will cover what you may experience during a colonic. When you normally feel a bowel movement it's coming because it starts to descend here, and then it gives your internal sphincter a signal and it says, we have to have a bowel movement. That's typically when you run to the restroom and have a bowel movement. You may feel full and uncomfortable when the water goes in at times. If that's the case, you can just slow down the water or turn it off. You're waiting for that internal signal that you have to have a bowel movement versus feeling full and uncomfortable. Your body will release when it's ready. You don't want to push because you're feeling full and uncomfortable, because then you're only cleansing this part of your colon. Again, it's best to just slow it down or turn off the water and then wait for it. Your internal signal is going to tell you when to release. You're just going to let it go. You don't want to clench your bum to stop it. If it's ready to go, you just let it go. The brain and the sphincter has a natural communication, so you may want to make sure that you're not clenching. You have to remind yourself. This is a different body experience. Normally you're sitting at the toilet. Here you're laying down, so you want to make sure you mentally relax your bum and remind your body that it's okay to let go in this position. Also, you may feel gas. Gas can get stuck in the colon just like the stool does. If you feel that pressure, don't stop the gas from coming out. We naturally sometimes clench because we're not used to passing gas regularly. You may experience some cramping, and if that's the case, again, just slow down the water at any time or turn it off. You're in control of the water flow. You can turn it off and then wait for 30 seconds or so. If that feeling passes, again, you can turn the water back on and allow the water to work on what it needs to. If you need more time with the water off, let it sit and turn it off when you're ready. A therapist will be here to guide you and assist you on what to do. I'd like to tell you a little about the device. The name is called LIBE, Lower Intestinal Bottom Bowel Evacuation. We change our water filters out every 30 days. There's also a UV light which helps kills any bacteria. One of the reasons why I named the clinic Clean Colonic is because I wanted to make sure people knew you were going to have a sanitary experience and a clean experience. We use everything recommended from the manufacturer for cleaning. We do not go outside of that. They have everything registered with the FDA and it's been tested. That is why you can lay directly on the cushion. It's sanitary and also will not harm your skin. You will also not smell anything during the session because the vent takes the air down the tube, up through the top of the roof, so that way you can feel comfortable when you start releasing. We will never smell anything. When you start releasing, your material will go underneath you, down the ridge and through the hole to the view tube and down to the sewage. You can look and see what's coming out if you choose through the view tube. Everyone gets a new nozzle and flex tube. We dispose of it after. You can see that it's pinky size and it's only going to go in about 1 inch. I'm going to let some of the water out to take out some of the air and also to warm it up. I will show you how to get up and then I'll leave the room for you to do your own insertion and get on the device. You will pull this off because I want you to be the only one who touches it from a sanitary standpoint. You can then use the lube on the outside around the edges, not on the top because that's where the water comes out. Once you have removed the paper and put it into your trash, you're going to get on the table, one leg to the side, hold the nozzle, and then find the opening of your rectum and slide down on it. Once you feel your rectum open, it will just wrap around it. You'll want to make sure you are down as far as you can with your butt at a slight angle. You don't have to worry about going too far. The table is designed to only allow it to go so far in. You may feel like it's not all the way in. The therapist will be able to determine if it is or not. Not by looking, your modesty is always protected, but by turning on the water and seeing if it comes out right away. Once you're on the table, you will then take a disposable sheet and cover yourself. And then hit the call button and your therapist will come right in. Relax, and if you have any questions, please ask. We are here to help you and assist you in this process. If during the session you feel like the nozzle may have fallen out, please do not touch it with your hands. There might be a little bit of bacteria on there, so once the session starts, instead, touch the call button and the therapist will give you a glove to check and advise you on what to do. The session will last approximately 40 to 45 minutes of water. Once you're finished, you will be able to rinse off with the sprayer hose to complete your clean experience, and your therapist will then check you out. I'm so glad that you chose Clean Colonic. This is one of the best things that you can do for your gut health.